Today, I was asked by our hospital leaders to confirm that Ohio remains in a state of emergency. I'm telling you tonight, it most certainly does. This state of emergency supports their ongoing efforts to make staffing adjustments in accordance with CDC guidance as they work to care for our rising number of COVID-19 hospital patients. Martin Luther King once said, and I quote, that every crisis has both its dangers and its opportunities. In this most dangerous phase of the pandemic, as Ohioans, we still have opportunities before us. We can control our fate. And the good news is that we don't have to search for the tools to fight back. They are ready at hand. We've used them effectively before, and we must use them effectively again. We got to get back to basics. Wearing a mask, maintaining at least 6 feet of distance from each other, washing our hands frequently, and not having parties and get-togethers in your house, and trying to get adequate fresh air into our homes, particularly as it's getting colder. What each Ohioan does in his or her own life impacts all of us. It impacts every community. It impacts every school, every nursing home, every hospital, every business. And the more people who get the virus, the more likely it will spread to all the places that we desperately want and need to keep open and operating. Just yesterday, I received a letter from a local school superintendent who was concerned about community spread in her community. She said, and I quote, that people don't seem to understand that while COVID exposures are occurring outside of the school setting, they are having a profound effect on our ability to keep our school open. Now, the simple truth is that your local school will not be able to stay open if it can't keep teachers in the classroom and bus drivers in buses. This virus threatens our ability also to keep our grandparents safe in nursing homes, our hospitals functioning, our businesses open, and our citizens working. We must do the basic and necessary things to protect those at the front lines. Our nurses, our doctors, our health personnel who are treating patients, our grocery store workers who are keeping our stores open, our teachers, our bus drivers, our child care workers who are helping our children. Let me tell you about Jen. Jen's a nurse at Ohio Health. During the start of the pandemic, she was on medical leave, courageously fighting breast cancer. Just as soon as she was medically cleared, Jen jumped right back into action and returned to work, first managing patient cases over the phone, and now caring directly for her patients. She wears a mask at all times. She stays home while not working in order to stay safe and to protect her elderly parents and her patients. And so as we wait for this vaccine, we have so much to protect. We can't surrender to this virus. We can't let it run wild until enough of us get the vaccine. It's advancing quickly and seeking victims in every community in Ohio. If you don't know any of its victims yet, sadly, I suspect you will.